Bezlotozumab for prevention of recurrent Clostridium Difficile Infection. Definition: Clostridium difficile is the most common cause of infections in rare and hospital patients. Recurrents are common after antibiotic therapy. Actosomum and Bezlotozumab are human monoclonal antibodies against Clostridium difficile toxins A and B respectively. Clostridium difficile. Clostridium difficile bacteria is a species of genus Clostridium, which are gram-positive spore-forming bacilli, straight anaerobies. Development of infection. Clostridium difficile is a type of bacteria that live in the intestine of many people. For these people, Clostridium difficile is part of the normal balance of bacteria living in the intestines. Most people never experience any problems with the bacteria, but if something upsets the balance, Clostridium difficile can start to grow weakly, starting to release toxins that attack the lining of the intestines. Symptoms of Clostridium difficile infection: frequent leakage diarrhea, intense abdominal pain or abdominal pain to the touch, loss of appetite, and blood or pus in the stool. Causes: take antibiotics, especially a broad-spectrum antibiotic, or have been taking antibiotics for an extended period of time, surgery of the gastrointestinal tract, abdominal surgery, hospitalization, living in a nursing house at a chronic care facility, colon problems such as inflammatory bowel disease of the colorectal plus cancer, weakened immune system, previous Clostridium difficile infection, B65 or older. Bezlotozumab. Bezlotozumab trinase implavate is a human monoclonal antibody designed for the prevention of recurrence of Clostridium difficile infection. How this drug developed? This drug, along with Actosomum, was developed through phase 2 efficacy trials by a partnership between Metals Inc. and Mass Biology of the University of Massachusetts Medical School. The project was then licensed to Mark Sharp and John Carr for future development and commercialization. Applications in medicine: 2 random placebo-controlled randomized placebo-controlled modified 1 and modified 2 clinical trials involving 2,655 adults who received standard oral care antibiotic for primary or recurrent Clostridium difficile infection were enrolled. For approval, participants received an infusion of Bezlotozumab. Placebo. Actosomum alone was given in modified 1 but was discontinued after a plain interim analysis. The primary endpoint was recurrent infection within 12 weeks after infusion in the modified intent to treat population. Results: in both trials, the rate of recurrent Clostridium difficile infection was significantly lower with Bezlotozumab alone than with placebo, and was significantly lower with Actosomum plus Bezlotozumab than with placebo. In a specified subgroup analysis, the rate of recurrent infection were lower in both groups that received Bezlotozumab than in the placebo group. In the subpopulation at high rates of recurrent infection offered adverse outcome. The rates of initial clinical cure were 80% with Bezlotozumab alone, 73% with placebo. The rate of sustained cure were 64%, 58%, and 54% respectively. Pros and cons. The use of Bezlotozumab is very important for the treatment of Clostridium difficile infection. Among its benefits, we found that TDI recurrence was significantly lower with Bezlotozumab than with placebo in modified 1 and modified 2. Overall rate of adverse events were similar between treatment groups, more common in diarrhea and nausea. However, in patients with a history of conjunctive heart failure, recurrency 12.7% of Bezlotozumab-treated patients compared with 4.8% in the placebo group during the 12-week study period. In addition, in these patients, Bezlotozumab recipients had a higher mortality than placebo recipients. Conclusion about the investigation: Among participants receiving antibiotic treatment for primary or recurrent Clostridium Difficile Infection, Bezlotozumab was associated with a substantially lower rate of recurrent infection than placebo and has a safety profile similar to that of placebo. The addition of octuzumab did not improve efficacy. Thank you.